at Atrium at their headquarters in Charlotte, hanging out with some of their team and leadership and with the Chime team. And really, it sparked some great conversation about why and what we're doing here together that bears light on this conversation we're about to have with Reed and St. Luke's. The CIO there, Rasu, talked to us about what their innovation departments, how they see themselves, sort of their meta understanding of what innovation is and how it works. And they talked about that they are architects of ecosystems, that in the healthcare world, you have to create these networks of entities that are working together because the system is so complicated, the system is so bifurcated, and oftentimes weighted against change, that bringing in innovation is really an uphill battle. So creating these architects of ecosystems that bring together the right minds, the right decision makers, the right big ideas, and pinpoints them at particular problems is what we're going to have to do to see the system change. And that's exactly what this challenge is about. It's taking ecosystems of communities together, partnering them around central ideas, and bringing those ideas to bear in a matchmaking process that delivers the right innovation to the right problem at the right time with the right people. So that's what a challenge is for us. We've created that architecture of ecosystems with the Chime community, and we are continuing to hone exactly what we need for each of the partner health systems that are raising their hand and saying, we need help here. As innovators, it is an uphill battle. The system doesn't often invite you in. And so we're trying to create the right understanding of what the need is for the hospital community so that you can translate your company, your innovation, your value proposition, and the stage and space you're in to those in the chair trying to make the decision as efficiently and as positively as possible. So a challenge with Scale Health and Chime is to work with multiples of hospital systems, which we found out we're going to be adding a few more. You'll hear some announcements next week about more hospital systems coming online, maybe as many as 5 more. So systems nationwide that are raising their hand and saying, we have things to address in the workforce world. We would like to understand more about your innovation, what you're doing, how you're doing it, at what phase, and then we're going to connect the dots and match them together. So from the Scale Health community, we're very excited for you innovators. We are a founder first company. We believe in what you're doing, and we have great faith in the ideas you've come up with. And we've been partnering with Chime, which is centered around the world of CIOs around the country, supporting them, training them, empowering them, and helping them find the right innovations at the right time for their hospital systems. I want to introduce to you John Mark, who's become one of my fast buddies. We hung out at dinner the other night, and I learned all about what he's been working on. So John Mark, tell us a little bit more about Chime and what we're hoping to accomplish here.
Thanks very much, Chris. I'm really excited to be part of the challenge again. We had a great time with a really quick turnaround for challenge number 2, which was all focused around patient engagement. And it was a really great opportunity to get to know members of the startup community, to hear their stories, right? My background is in journalism, and I love stories, and I love to hear the stories of how people got involved in launching an enterprise, all of the different components of a person that would make them want to do that, and their heart for healthcare, their heart for making change, and their heart for leveraging technology. And really, we're here to support our Chime membership and the wider innovation ecosystem. Innovation is all really about, at the end of the day, if it's successful, it's about listening to your customer. I learned a lot about listening to the customer, doing some training with the Strategizer company that developed a business model canvas. But as I started thinking about how it applies to healthcare, the big aha moment for me was realizing that in that last box, that customer segment box in healthcare, that box has got at least 3 to 5 different parts to it. You're always listening to not just the patient, the patient's family, but the customer might be the clinicians, the customer might be the hospital itself. And so figuring out how to think about all of those various customer segments is what kind of makes innovation in healthcare a lot more difficult than in some industries. So this challenge is a big part of kind of solving that puzzle for these very busy chief information officers, chief digital officers that we're serving every day. And Scale Health has become an amazing partner, good friends. Had a great time getting to know them better. but just, an amazing group, amazing people. And it really feels good to know that at the end of the day, we're actually doing some good. We're benefiting our members, we're benefiting the startup community, and hopefully at the end of the road, we're going to benefit thousands and thousands and hundreds of thousands of patients and their families where they live in their lives all around the country and around the world.
Excellent. Thanks, John Mark. For the next little segment, we're going to have a great fireside chat to understand more about one of the hospital partners who's participating in the challenge and the particular needs they have. My partner in crime and the person that keeps me straight is India on our team and our VP of operations. So I'm going to hand it to you, India, to talk more about what we're going to do next.
Right. Thank you so much, Chris, for the intro. I appreciate the little shout out there. I do my best to try to keep the team operating as efficiently as possible. So I want to go ahead and just thank you all first for joining us for the first of 3 webinars as a part of the Scale Health and Chime Workforce Challenge. So thank you all for taking the time to be here. I'm so excited to spend the next 20 or so minutes leading a conversation with one of our participating health systems as a part of this challenge. We'll be talking to Reid Steffen, CIO of St. Luke's Health System. So before we go ahead and get started with the conversation, just a few housekeeping items. So as I mentioned, we'll have a little bit of a chat for the next 20, 30 minutes or so. We have some really great questions to get Reid's perspective and insight on that I'm sure will be very helpful in informing your application as a part of this challenge. As Reid is sharing his insights, if there are any questions, comments, feedback that you have to share, we want this to be an open conversation. And so please feel free to use the chat box to type any questions out with any reserved time that we have at the end of the conversation. We'll kind of go back and make sure that some questions are answered. So please feel free to use that as any ideas or thoughts come up in your mind as we go through this quick fireside chat. So with that, I am very excited. Reid, thank you so much for joining us. Please, just to cover all of the bases, can you just give us a brief introduction to yourself? And for those who may be unfamiliar with St. Luke's, can we get an introduction to the health system as well?
Yeah, happy to. Thanks, India. Good morning, everybody, at least morning where I am in Boise, Idaho. So Reid Steffen, as mentioned, CIO at St. Luke's. I've been here for almost 12 years now. Initially came in doing cybersecurity, was the CISO for a number of years, and then have migrated positions. About 5 years ago, took on the role of CIO, and just really love not only what I do, but in particular why I do it and who I get to do it with. St. Luke's is a not-for-profit health system. It's community-owned, based in Boise, Idaho. We serve consumers, our communities across Southwest Idaho and into a little bit of Eastern Oregon. We have 8 medical centers, a children's hospital, about 400 clinics or other service centers serving the needs of the communities across this area of the country, which is a mixture of some urban areas like Boise, Meridian, Nampa, but then like you would maybe think of in Idaho, also some very rural communities as well. And so it's kind of a nice combination of opportunity that we have to navigate as we again strive to meet the needs of all the members of our communities, no matter where they live. So if you think about that, being innovative in how we deliver care across a variety of settings and a variety of kind of socioeconomic statuses is really, really important. There's not a one-size-fits-all approach for us. And so also as a not-for-profit system, our CFO always says, no margin, no mission. So we also have to figure out ways to do this that meet our budget and the ability that we have to invest in innovation opportunities. So I'll stop there because I really want to kind of get into kind of the dialogue, India. So.
Yeah, absolutely. No, thank you for the background there. Just to jump right in, right? Your role as CIO, can we talk a little bit about how you and St. Luke's view innovation, if there's anything really unique to the way that you approach this topic that could be helpful for our innovators on the call today?
Yeah, I'll share how we think about it. I'm not sure if it's unique, but it's maybe there's some nuggets here. So a few years ago, we really wanted to embrace this idea of having innovation be kind of a repeatable discipline or mindset within the system. We don't have the idea that innovation lives in an office. So we don't have a chief innovation officer. We really want to have this mindset of not innovation being like the accountability of a few, but really kind of the mindset and the responsibility of everyone within the health system. So we've tried to create a culture and an environment where innovation can feel safe and supported and celebrated. It can happen at any corner within the organization. We feel like one of the needs is to have a clear definition of what innovation is. It's one of those words it can be heavily loaded. People can bring their own kind of mindset of what it means, which at times can be, I think, a limiter to how you actually embrace and do innovation. So we found early on that a lot of our folks in our system had this idea of innovation being like a moonshot, like it had to be like an Elon Musk type disruptor within the organization or within healthcare, when the reality is, at least for us, like that'll be a rare, if ever, kind of occurrence. Really, innovation is about not doing something that's never been done before, but doing something maybe that you've never done before, or doing something that's a little bit better than you have in the past. So we've tried to like demystify the concept and notion of innovation and make it this kind of understood, shared competency that anybody in the system can engage in. And it's really kind of founded on these three principles of empathy and curiosity and rapid experimentation. And we'll probably kind of dive in deeper into those as we go along here, but maybe just a bit on empathy for a minute. And for those that are on the call, I think for us at St. Luke's, what we look for when we're going to innovate, and if we need to bring in a partner, and that's a key word, it's not a vendor, it's not this transactional relationship. We want a partner. We want someone that takes the time to get to know us, that has empathy for who we are, what we do, why we do it, the unique circumstances or challenges that we may be facing in our market or with our current operations at the moment. Because that really, I have a good friend that says, empathy is the heartbeat of healthcare. And that's such a true statement. And so the idea of empathy that I think drives the idea of partnership, it drives the idea of we're not looking for point solutions because we just can't financially sustain that kind of an acquisition model. We're looking for platforms and partners that we can have innovative solutions that meet a variety of opportunities or needs we might have.
Fantastic. No, I love to hear it. There's so many things that are resonating with me that you just mentioned there, Reed. First and foremost, right, that definition of innovation as an innovation ecosystem, community, and marketplace here at Scale Health. That's something that we talk about on a day-to-day basis, right? Because that term does come with lots of implications and concerns for folks. It can be a little bit loaded and scary. And so trying to demystify that a bit is a lot of the work that we're doing. And so very much aligned with you there. And then I personally am very passionate about human-centered design and, really understanding your user base, and that empathy piece is so crucial and important. So great to kind of reference that for our innovators on the call as well too. Just to talk a little bit more about how you guys historically have worked with startups and innovators. As part of the Scale Health community, we have innovative solutions that are coming to us at all stages in their development, from on the earlier side, startups to growth stage as well. And so can you give us any examples on how you specifically have worked with startups, things that you'd like to see? What's that process like for St. Luke's when in terms of how you engage?
Yeah, I think for us, what we've learned is it's really important to start with a clear definition of the problem or the job to be done, because it's really easy. And I've fallen prey to this many times, and it's just a natural tendency. It's exciting sometimes to see something new, and then you lead with kind of the supply side driven approach to innovation, where you have this really cool kind of capability or solution, and then you try and figure out, well, how can I use this to solve a problem that might exist in my organization? And we found that is a pathway that often, yields frustration. It can actually be detrimental to innovation, because then it creates this mindset of like, oh, that's just pie in the sky. It's not grounded in reality. It's where resources go to die. So really starting with the idea of like, what's the problem? There was the comment earlier by about using the strategizer, business model, value proposition canvas. So we use those kind of frameworks to really make sure that we identified of all the problems that we could solve, like have we really aligned in on like those that are kind of most acute. And then with that in mind, then we look for partners that are bringing forward innovative or unique solutions. And again, ideally, a platform kind of type solution that can solve not just one problem, but multiple problems. So leading with kind of the demand side driven approach to innovation has been key for us as we then go and look for partners to help us solve those problems.
Awesome. And to dive into that a little bit more, I heard you kind of going in that direction. As you know, a part of this workforce challenge between Scale Health and Chime, as my partner Chris referenced, there are now 10, maybe plus health systems that are all interested in reviewing and evaluating technology that comes through this challenge. I know, of course, across health systems, you know, there's going to be that minimal level of expectation that the health system executives want to see before deciding to engage. But for St. Luke's specifically, is there anything that you're looking for in terms of solutions, regulatory requirements, HIPAA related details, or having a number of successful pilots secured? What in terms of like just minimal expectations do you need to see before having a conversation to potentially move forward with exploring a potential solution?
Yeah, that's a really good question. So I'll kind of take it from, you know, maybe table stakes most important to more of kind of the nice to have elements of it. So for us, what we found as we work with emerging companies, startups, we want some, and we understand that, you know, you're not going to have like a fully formed, you know, IT security department, like with tons of resources. But we do want to have just evidence that that mindset is at least baked into what you're doing. So kind of out of the gate, we want it to be a pretty straightforward process to be able to sign a BAA. We want to have kind of an understanding of how security capabilities and principles are being built into the solution rather than an afterthought or something we have to bolt on later. So you think about things like HIPAA, really securing if any kind of patient data is involved. We want to understand and see evidence that that data is secured, you know, in transit, at rest, when it's being manipulated or used in any way. And then from there, like with those things in place, I think what will be of interest to us is, you know, if there are other pilot sites you have that have started to kind of yield some good evidence, I mean, it's not going to hurt. Like that's going to be yet just some more evidence that, yeah, there's probably something here based on other colleagues and peers in the industry having gleaned value from it. But I would say that for me, like, you know, my own personal mindset is, and maybe there's a little bit of a desire to like, you know, not get there first, but there's something fun about kind of being in the early stages of it. If an idea comes across, and again, it's got some of those basic security and compliance things that we feel are being thought about and baked into it, even if no one else is doing it, if we feel like, back to the problem statement, hey, this is really going to kind of scratch that itch, the fact that we might be the first ones to try it is not going to be a detriment. Because again, back to one of our principles of rapid experimentation, like we will want to learn quickly with the innovative startup. We'll want to have a designed kind of series of tests for like, here's the assumption, here's the process by which we're going to kind of validate and test that assumption. And here's the quick cycle we're going to follow then to take what we learn. Because the reality is these assumptions rarely will kind of survive that first encounter in the real world. And so it's not, you know, we don't talk about failing fast, we talk about learning fast. And so I love the idea of learning with that innovative partner. And as long as we can have that quick, rapid experimentation cycle, you can generate a lot of momentum and utility through that. So the idea that no one else has done it yet isn't really a detriment in my mind if some of those foundational requirements are in place.
Awesome. Very helpful for any of our innovator startups online. Understanding that whole regulatory process and things can be quite daunting as well too. And so that's something that the Scale Health team, we want to make sure that you are supported in preparing to work with an entity like St. Luke's. And so as you are completing your assessment process, if there are questions that come up related to our standard HIPAA and info security assessments where you could use additional support, or we could come on and help answer some questions and provide more clarity, that's what we're here to do. And so for any folks that would like to utilize us as a resource to help prepare for these sorts of opportunities, we want to be there for you. So please feel free to reach out to anyone on the Scale team. We have experts that are a part of the Scale family that we can connect you all to help you position yourselves appropriately to check off some of those boxes that Reed is referencing here. So please let us know as you're completing your applications how we can be supportive on that level. Reed, transitioning over into now the topic of the workforce challenge, of course, all around workforce solutions. I think it would be a complete missed opportunity, of course, to talk about how the COVID-19 pandemic has impacted that space. And so I know, as I probably can imagine, it has drastically exacerbated challenges that you are facing at St. Luke's. And as we work with tons of health systems across the US and internationally, we're hearing the same thing. And so any insight from you just in terms of, how the industry and the market has changed just after the past few years?
Yeah, and I hope this is helpful for those on the call. Healthcare in particular, when you look at the data of all kind of sectors, we've had this declining kind of margin of return in terms of productivity compared to other industries. And that's not like this aha realization. I think that was kind of understood, but pre-COVID, it kind of felt like, we're going to have to solve for this, but we've got some time. Because for years, the way we've masked this productivity challenge is we just kept adding bodies. We would just hire more clinicians. We would hire more shared services people. Like that was our Band-Aid for a lack of productivity. COVID really kind of brought this looming challenge to our doorstep with an immediacy that was really, really impactful, and became really apparent that we're not in a sustainable kind of approach going forward. And so a lot of the financial pressures that you've heard about with healthcare in the last couple of years is directly because of that lack of productivity. And as we had to scale up clinicians in particular, and there weren't enough nurses, for example, to meet the need. And so then we have to do travelers, and the expense of that, which is think of it as a nursing contractor, it's just not a sustainable model at all. So, for me, what we learned from COVID is we have to think differently now. We don't have years. We've got a much shorter kind of time frame to figure out the productivity challenge facing healthcare. And I think what you're going to see is those systems that can effectively do that, they're going to emerge stronger. They're going to be able to better meet the needs of the communities they serve. But you're also going to see a lot of, especially critical access or standalone healthcare entities that just aren't going to be able to navigate this. And there's going to be kind of this shift. It could be consolidation. It could be, unfortunately, some communities just lose that healthcare entity that exists there because they just can't function anymore. So innovation that's going to help us be more productive is really going to resonate and be attractive. Innovation that's going to help us care for people in communities that don't have the physical proximity access to healthcare they've had in the past is going to be a hugely needed capability in the coming months and years. So for me, what really keeps me focused right now is what are the platforms and the innovative things coming forward that are helping me address productivity. We know that we're not going to graduate nurses and doctors at the pace that we need to based on an aging population. Therefore, we're going to have to deliver care differently. And it's going to be innovative solutions, a lot of it technology-based, that's going to help us kind of bridge that gap.
Awesome. It's a great segue into the next question. For those of you who are joining us after having participated in the CHIME Scale Health Patient Engagement Challenge earlier this year, I want to make a quick call out. There were challenge categories related to patient engagement there, and we had particular health systems that were maybe interested in exploring a particular category, maybe more than the others. And so we had kind of done some matchmaking from that perspective when it came to participating health systems and categories or topic areas under the umbrella of patient engagement. For this workforce challenge, we have 3 particular categories that we're exploring. And because of some of the things that Reed mentioned, it is so top of mind for all of our health system executives right now. They've all expressed interest in wanting to explore solutions related to all 3 challenge categories. And so as we go through this evaluation process, we'll get each health system's perspective as it relates to these 3 categories. But I want to quickly talk about those individually, Reed, and get your perspective on, of those 3, are there any, is there something that you're gravitating more towards? I hear you referencing productivity a lot, and so would love to get your perspective there, but also just talk about the other 2 challenge categories and see, where your mind is at when you think about these. And just to reference those for the group, the 3 challenge categories as a part of this engagement will be staffing precision and planning, workforce engagement and retention, and AI-enabled productivity and performance. So Reed, as we explore those 3 categories, just any thoughts or comments that come to mind related to those?
Yeah, the AI kind of enabled opportunities is, and certainly not unique to St. Luke's, just of great interest. And it's been fascinating. Hasn't even been a year. Like, AI was always kind of on the radar. But, I think Thanksgiving of last year was when I first started to dabble with ChatGPT. And it's funny how something that wasn't, a kind of foreground thought just can, with such velocity, enter into kind of then your ongoing active planning. And then to see then how that's impacted a lot of our vendors and their roadmaps. So AI now really kind of dominates a lot of the conversations that we're having about how we think about being more innovative in the way that we use AI just in the course of normal clinic, back office, just general healthcare operations. And so for us, it's been, the way we're kind of thinking about it is we've kind of bucketed it into 3 different categories in terms of how we embrace AI. The top bucket is what we call integrated. And if you kind of go down these buckets, we go from more control, less risk, to less control, more risk. So integrated would be, we have an existing vendor, so a Microsoft or an Epic, which is our EHR. They are then integrating generative AI type capabilities into the products that we already own and use. And because they're being used within these products that we already own and use, there's a perceived, and I think a real degree of control and influence that we have. So for example, one of the capabilities that we're looking at today is within Epic, there's a feature called the In-Basket. And this is essentially like an email inbox for providers and clinicians. And it's the bane of their existence. It is the volume of messages that they have to process in this inbox or this in-basket is, they call it a hassle factor. Like it's a burden for them. They have what they call pajama time, where they feel like there's not time in the day to do it. So they do it at night when they're at home. In particular, our docs that are in primary care. And so what's interesting is, like, it's always been there. But back kind of to your question, India, about like a COVID impact, COVID ushered in a much broader adoption of telehealth and using MyChart to send your provider a message. And so now what we have is, in some cases, this provider messaging, which is meant to just be for more kind of innocuous questions. We've got some patients then that use it to try and like have an asynchronous provider visit. So, but that still plops in the provider in-basket. So using ChatGPT, Epic is integrated in the ability to auto-generate a reply to these in-basket messages. Doesn't send it. You still need the human. It just augments the human kind of cognitive ability. But in theory, it lets providers and clinicians then process through those messages more quickly. So that's kind of the integrated AI component. And then we have what we call kind of our managed AI component. So we have stood up an instance of Azure AI where we can have our own St. Luke's managed version of OpenAI's ChatGPT, pointed at the data that we want it to learn from, and then we want to glean some kind of AI advantage around. Again, we feel like we have high control, kind of high touch over how people use that. And then the last bucket is like public. So this is more of what I think the majority of humans use generative AI tools for. This is the ChatGPT, the Google Bard, the Claude, those kind of things. And we know employees are using those, but we have much less control over kind of how they use it. So there's more risk. So I think that solutions then that let us maybe harness those public tools in a way that we hadn't thought of, or a way that's kind of provide that safety net, or just the reassurance that we have some kind of degree of control, I think would be really, really interesting as well. So, but that's of those three categories that you mentioned, like they're all important to us, but I can tell you that generally the AI component is top of mind, and not just within our IT department, but like it's been fun to kind of understand just the different areas of the organization that have kind of grasped onto this and realize this can be a real benefit for productivity. It can be essentially, I have now this digital assistant that doesn't replace the work I do, but it can lift some of the cognitive burden of things that I've had to do in the past. And it can get me, instead of starting with a blank sheet of paper, I got a rough draft now. And so I can do more with less, which is really, really compelling.
It's awesome. And to talk about that a little bit more, you know, as you're exploring these new AI tools related to productivity, and you're seeing those trends over the next year, is there anything else in your mind that stands out in terms of where you kind of see that space evolving?
Yeah, I think that, well, I think this is where it needs to evolve. So this is more kind of the, I think the social kind of aspect of it, because now as we have these capabilities, well, then the question starts to become, so for example, we have today patients, this mindset that if they hear something from a nurse or from a PA, they're like, okay, but I want to hear it from the doctor. Like, even though the doctor is going to say the exact same thing this other clinician said, we've kind of created this understanding, this mindset that, like, you know, the doctor is the authoritative source, and I need to hear it from him or her, and from somebody else that I perceived as lower. I need that verification. So I think that we're going to have this moment where we have this incredibly new, powerful capabilities with AI, but now we're going to kind of face this pressure from consumers and patients who are like, well, we don't trust that. Like, we want to hear from a doctor, or we don't want the AI involved. We don't trust it. We think it's biased, or, you know, we just somehow feel like it's not as safe, even though the reality is that that doctor you're seeing, like, you don't know where they graduated in med school. You don't kind of understand their capabilities. So it's just really interesting as we think through, how are we going to tackle this? Like, at some point, do we have to notify patients, like, things that are generated by AI but validated by a human doctor? Like, do they need that level of granularity? So I think as we build these capabilities into our tools, I think part of the innovator's mindset has to account for just kind of that psychological element that's related to all of this. And I think companies that figure out how to marry that in a way that makes it feel safe and supported and accepted by consumers and by clinicians, you're going to have an advantage. It can't just, like, I don't care how great the innovative technology capability is, if you can't kind of overcome the hurdle of that perception, or the kind of that social or that emotional kind of expectation, it's just not going to fly.
No, completely agree. As we go ahead and wrap up this conversation and go into questions, please, anyone, if you have any comments, questions, please use the chat. We'll circle back to some of those. Rita, I want to just get your final words and thoughts for any of the participating companies as a part of this challenge. Anything to leave off with them?
Yeah, I didn't mention this in my intro, but when I joined St. Luke's 12 years ago, it was my first foray into healthcare. I spent about a decade at HP, had been consulting before that, really like in high tech kind of areas. And when I first joined St. Luke's, and it wasn't like overt, it wasn't like this huge obstacle to overcome, but there was kind of this undercurrent of, I was a healthcare outsider, and therefore I couldn't ever fully appreciate or understand. I'd never be like a fully vested member of the community. And I think that I've seen that mindset really kind of start to erode in a good way over the last decade. But you still may kind of come across undercurrents of that. So kind of back to that foundational element of empathy. I think that, and curiosity, I haven't talked about much. I think that as you consider your ideas for innovation, as you have the chance to interact and talk to other healthcare entities, really leading with an attitude of empathy, being far more curious than certain. Like even if you're really kind of confident in your idea, your hypothesis, your approach, be vulnerable, lead with a lot of curiosity, ask a lot of questions. And I found that helps whatever remnants of that mindset that still might remain out there, that if you weren't raised in healthcare, you can't possibly understand and help healthcare solve healthcare problems. That'll be the key to kind of unlocking any of that kind of mindset that might exist out there, is just really ask a lot of questions, be curious, and you'll find in the course of that, there'll be real natural ways to share your thoughts and ideas and the solution that you have.
Fantastic. Jumping into a few questions, we've got some really good engagement on our side here. Just back up to the top. So I think some of these may kind of been touched on in some of Reid's answers, but just to kind of double down on some of that. So it seems like there's quite a few questions related to, I think, a phrase you had used around platforms and not point solutions, or platforms and partnerships, not point solutions. So any more clarity you can provide related to that? Seems like maybe folks would like to hear a little bit about how you envision a solution needing to integrate with some of the platforms that you currently use at St. Luke's. And if you can give some insight into what those platforms are so people can start to think about that process a little bit. But any reference to a little bit more color on the platforms, not point solutions, I think would be very helpful.
Yeah, no, I think that's a really good question. So let me try and give a couple of examples. One is, it's kind of easy. So Epic is our EHR. Clearly, that is our platform. That is our platform for how we deliver just the technology capabilities around the patient record, provider communication, just the workflows associated with kind of the continuum of care for that patient. That's our platform for that. And so that doesn't mean that we don't look at other solutions. We kind of have a guiding principle of Epic first, meaning we look at, if we have a well-defined problem, we look at, can Epic help us with this problem first? And if it can, or if it's on their roadmap, we're going to kind of adhere to that. Because again, we just don't have the resources to go out and be able to knit together all these various kind of point solutions into kind of that platform view. So I share that because, as you innovate in the healthcare space, understand that like Epic really is kind of the king of the mountain when it comes to EHRs. There's others that are out there for sure, but they have a large percentage of the market share. They also do a really good job creating strong partnerships with their customers. And they also have, they've gotten much better at this, I think, in recent years, opening up kind of their ecosystem, so to speak, to allow for partnerships with people like yourself that are bringing forward innovative solutions, that instead of having to be like a standalone kind of on its own, trying to figure out how to make forays or kind of breach into healthcare, if you can integrate it with Epic, and if you can demonstrate, and Epic has a program called PALS that's about my extent of the knowledge, but just think of it as a way to kind of validate and verify that. It's kind of like, think of the Apple Store for their apps, where they go through a series of validation to make sure that the software is safe and secure and actually integrates with the Apple hardware. The Epic PALS program is a similar thing, right? You just go through some vetting steps where when you have the PAL seal of approval, Epic customers know that, okay, this vendor, I know that it can integrate with Epic and is going to work as advertised. So not that you have to, but I think it's just I think that could be an advantage. If you have a solution that you know can augment or enhance the EHR experience with Epic, then I wouldn't try and do a castle assault against it. I would figure out how do we kind of weave this into Epic where it's viewed as just part of this platform solution we have as an EHR. So that's one way that I would kind of maybe think about that. And the other thing I would say then is another capability that we're really pursuing is what's called ambient listening. So back to kind of the provider hassle factor, the ability to use technology to listen to, in particular in primary care, that patient doctor kind of visit, and then pull out the medically relevant details and auto-populate a note. So, I mean, just instinctively you think like, well, yeah, if that works, that would be awesome. Because if you've gone to a doctor and you've had this experience where the doctor is like on the keyboard trying to like note down the things you're saying, it just feels weird. Like the doctors hate it because they're not able to maintain eye contact with the patients. They feel like they're being perceived as not engaged when they're really just trying to capture like what they're hearing. So this ambient listening solution then can help solve that burden. So that's one piece of it. But what we find is that ambient listening as a platform, well, it can do other things as well. So it can not only generate that note after the visit, but it can then, as the AI evolves, it can pull out like, hey, based on these things we heard, here's the codes that you need to build based on this visit. And so then in the course of that, evidence is showing that it does a better job of doing that than humans do. And so what then you see then is you're accurately billing for the visit, you're getting a higher level of revenue because you're billing appropriately for all the things that should have been coded during that visit. So again, it kind of builds on. It was meant to solve one need. Hey, how do we make the life of the provider easier? But then there's other benefits that it's solving for as well. So as you develop solutions, like maybe you start with one problem in mind, but then start to think of like, well, laterally, like what are other things that this can also do? And the more kind of use cases, wins that you can tack on to your solution and make it a broad platform, then the more valuable that's going to be perceived by the health systems that you work with.
Awesome. That's great. So quite a few questions related to your view on retention strategies at Lux. I want to make sure we can touch on that a bit too. But first, I want to just continue to like close the loop on your thoughts around productivity tools, since I think that's most top of mind for you. And Mark has a really great question here that I will actually read verbatim just to make sure we don't miss any key pieces here. So just to kind of go through this together, question is at the root of productivity and use of technology to enable improvements in patient and provider satisfaction. So Mark here says, technology is an enable and facilitator, but the other piece of the puzzle is the process transformation and alignment of best practices and aligned clinical and business processes across the continuity of care. So Reed, just a little bit of insight into how both of those two parts intertwine, because one without the other doesn't move the ball forward for you. So just a little clarity there.
Yeah, and the clarity is probably just gonna be like to double down on that question. So it's 100% correct. Technology, it's not magic. It can't atone for or solve for underlying inefficient processes or bad data. It can potentially just maybe accelerate or amplify the impact of those bad processes and the bad data. So completely agree. It's a hand in glove experience for sure. And you have to start with making certain that the underlying workflow is as lean, as efficient, and as productive as possible. And the technology can certainly at that point then be an amplifier of that good underlying process. So it's, for me, it goes without saying, but I appreciate the question, and that I think that's important because that needs to be kind of built into then the engagement you have with the customer. And so to the degree that you can help the customer assess and understand the underlying process that your solution is going to be aimed at, I think the higher your degree of success is going to be. Because if they have a bad process but don't know it's a bad process, and then your innovative solution then maybe just shines a light on that, and because they then suddenly see, because it's happening at a faster pace or a broader scale. And then they erroneously think that like, well, yeah, this innovation is bad because look at this outcome. I mean, that is absolutely going to be a key nut to crack. But it is not a, it's a well kind of understood concept among the CIOs, certainly kind of my network of CIOs, that we've got to start with kind of the process first and the people, and then the technology piece can then be an enabling component to all of that.
Absolutely. Fantastic. And last question related to productivity tools before we transition over to a few things related to the retention side of the conversation. We have a few folks that are asking to just get some more insight into, if you're able to share, right, some of the productivity tools and strategies that you're currently utilizing, where you may be seeing some gaps, where folks on this call may be able to help close for you in relation to what you're currently implementing.
Yeah, and so I'll start at kind of at the macro. So we're a Microsoft shop, and so one of the things that's of great interest to us is what Microsoft calls their Copilot, which is just kind of their collaboration tool suite, which is Outlook, Teams, Office suite of tools, but infused with generative AI. So doing things like after a meeting like this, right, it would summarize the key points that were talked about, the actions, who was assigned to, like it can do all that on the back end to then again free up the human that today has to kind of in the meeting track all that and do all that. So things like that are integrated are of great interest to us. What I don't know is like, what are the gaps in, like, what are the things that does that we really like, but then we're like, but if it only could do X, that would be so much better. And so I don't, because we're just kind of on the early stages of this, I don't have like a concrete example to give you, but I would just encourage you to continue to, one, use those kind of tools yourself, because I think you'll kind of then start to understand those struggling moments or those areas that are kind of unsubscribed to, and there may be niches that you can weave into. So the Microsoft suite is one. I think the other one for us is, I talked about the ambience listening. The other one is around what we call computer vision, which is more like kind of site-based AI, where a camera in the room can then start to learn what things look like. So it can learn what a patient in the bed looks like. It can learn what a patient who is a fall risk is now sitting up in their bed unattended looks like, so that it can then generate an alert so you can quickly then intervene before you have a fall, which is bad for the patient outcome. It's costly. Like there's a whole cascade of negative things that occur from there. The other area that's of great interest to me is what we hear from nurses when we round and talk to them is their documentation around, or their burden of documentation. Like that is, it weighs on them heavily. We talked about pajama time for providers. Well, nurses don't have pajama time. What they have is they stay an hour, 90 minutes after their shift, trying to catch up on the documentation, because all these things happen. And in the moment, they start to document, but then they get paged into a room. They have a code blue, or they've got some other thing that interrupts the workflow. So they got to keep in their mind, oh yeah, I'll get back to that and document that later. So it's not only them spending more time after shift, which is not good for their well-being. It's more expensive because of the overtime. The likelihood of them forgetting something that happened like 6 hours earlier is higher. It's a terrible process today, but it's just necessary evil. So then why can't this site-based kind of artificial intelligence, why can't there be capabilities that again learn what really kind of common nursing practices look like, placing an IV, flushing out a line. And so then it notices that it's like, hey, Nurse India was in this room with this patient, did this. And then it auto-populates that in Epic. It doesn't sign it, but it just captures, hey, you did this at this time in this room. So then the nurse then leaves the room, logs in Epic and is like, yep, I did that. And then they sign off on it. So there's just, I think, incredible opportunity in this space to bring forward solutions that use the data that we have available to us today, or that we could have with very little effort, to then reduce that burden of documentation on our clinicians. And you think about the amplifying benefit from that. The nurse then, not only are they spending less time after shift, not only is the documentation in theory more accurate, but then like they're fresher during their shift. Like they're not racing to the computer every second they get to try and document. They can actually spend more time at the bedside with the patient, talking to them. The patient then feels like I'm getting better care. Their HCAP scores go up. The pride of that nursing unit goes up because their HCAP scores go up. Their likely to recommend scores go up. There's just this rising tide benefit that touches so many things that will improve healthcare. And it's just a really exciting time to start to see these technologies converge, again, with the right workflows to support them. But they can really deliver on the long-held promise of really improving the care experience.
Fantastic. And those examples are super helpful. With our last few minutes here, I want to circle back to the retention conversation.
Yeah.
So kind of two parts to that. One, just any of your general thoughts in how you approach employee well-being, engagement,
Yeah.
retention. I think that would be great to hear, number one. And then
Yep.
number two, seems like there's actually quite a few questions interested in learning more about how, if you were interested in pursuing, moving forward with a conversation with one of these solutions that comes out of this challenge related to this topic, how would that look on an operational side? So are there particular departments that would get involved with this conversation, meaning, you know, HR, or would you be looking to tap leaders, your CNO example, just how that would work from a ops and logistics perspective related to any sort of retention tools?
Okay, yeah, so let me kind of tackle the retention piece first, and I'll kind of talk through like, well, what does that intake look like if we have what we think is a solution to a problem? Like, how do you become aware of that? So I think we've talked a lot about kind of the opportunities on the clinical side, and all the things I've talked about would help with retention. Like a nurse who knows that, hey, if I come to St. Luke's, I get to spend more time with the patient. And, you know, as use technology, like, for example, I didn't touch on this. We've got an aging nursing population of nurses who still have complete, you know, cognitive ability and still maybe want to practice, but like it's a physically demanding profession. And so they may get to a point where they feel like, I want to do it, but I physically can't meet the demands that I'm required at the bedside now. So I'm going to go do something else. Well, what if we could offer them the chance to, you could be a nurse, you can sit in a nice comfortable chair, and you can do like a virtual kind of nursing support model with technology kind of enabling that. That's going to help with retention. So I think there's a lot of threads you can probably pull on that for how innovative technologies can help with retention on the clinical side and address burnout. I want to talk a bit about the non-clinical side and maybe just specifically focus on IT. So we have a relatively low attrition rate in our department, but this COVID experience has brought on pre-COVID. We didn't have many folks that worked remote. It was really kind of a rare occurrence. We were in the office, and then this is not unique to St. Luke's. COVID really kind of introduced a new way of working, and now I would say we have probably 15% of our staff who are in the office all the time. These are folks who have to be here to do the work they do, clinical engineering. They have to be here hands-on clinical equipment to do that work. And then we've got a few folks that are full-time remote. Folks that typically when they're working, they're on a headset all day doing kind of transactional ticket-based work, our help desk, for example. And that's probably about, again, 50% of our department. The rest, 70%, are what we call hybrid, where they're in the office sometimes and not. And I would say on average, people are in the office 2 days a week. The other days they're home. So I share that backdrop. Again, it's a pretty common experience as I talk to colleagues. But one of the things that worries me is, and I'm fully supportive of the hybrid model. I think it helps with work-life harmony. We don't call it balance because I think balance is a false notion. And it creates an idea that you can somehow split yourself and you can meet the demands at work and at home and community, whatever, like evenly, perfectly all the time. And that's just not, like, you can't slice and dice your life that way, but you can have harmony. You can have the harmony to be able to pick the time and the amounts where you spend so you feel like you're where you need to be when you need to be there. But I do worry, and we're seeing a few signs of this. I think in terms of production, like, I think things are still fine, but we see more of kind of siloed mindsets. Like instead of like Reed and India, it's like the cyber team and the storage team. And you think about people instead of like as people, you think about them based on the work they do or the team they're on. And over time, my fear is that's going to erode culture that we have here, which is very much relationship based. So I think about, well, what are innovative ways that we can still embrace this hybrid model, but then in ways that we used to do in person before, that we can still create meaningful connections between, in particular, cross-functional teams without them having to be in the office, like serendipitously running into each other at the printer. And so I think that that's going to be a key part moving forward, is not only how do teams effectively like do the work that they're hired to do and be productive, but how do they kind of keep that concept of team in the way that we've known it in the past and really forge those relationships so that even if it's two-dimensional like this, it still feels like a three-dimensional connection. And I don't know what that is. I haven't seen anything that really kind of has sparked my curiosity or my like, oh, I really like that kind of concept. But I just share that as something that I think is going to be important for knowledge workers who don't work together in close physical proximity on a regular basis, to still develop and create those important connections that are core to making up a high-performing team.
Awesome.
And then I'll wrap. I realize I forgot the last part of your question. So then you have an idea. How do you kind of bring it forward? You know, I think that's something we're trying to figure out. That's why we're involved in this, is because I know like there are people out there that have incredibly innovative ideas and solutions and approaches that would directly kind of hit the crosshairs of a problem that we've defined. But if I don't know about them, like, how do you even find that out? So one of the things we've talked about internally is like, how do we make it easy for innovators like yourself to be able to like introduce yourself and bring forward ideas, but in a way that has more of a formal kind of intake process versus today what happens is it's luck. Like someone's at a conference, they hear about something, or it's word of mouth, or it's something like this where we kind of make connections. So we've thought about even, and I'd be curious kind of the feedback from this group, just like an intake site where if you have something that you think would benefit St. Luke's, we've got a simple way for you to introduce yourself. Not a cold call email, not trying to like, you know, find somebody at St. Luke's to talk to, but just a simple web form that you would fill out, that we would then have an intake process to kind of vet, to then give you feedback of like, yeah, we think this would be worth a further conversation, or, you know, right now this doesn't interest us, or this would interest us if it could do X. I think there's some things that we could do on our side to make that easier. And so that's just so you kind of know, those are the conversations we're having, but would love to hear input from, as we go through this challenge together, input from the innovators for how we can make that easier. Or even as I say that, I'm like, well, if we do that and 50 other systems do that, well, then you've got to go do that multiple times. Is there a clearinghouse kind of a model where we could somehow like move that upstream a little bit, and kind of like what this is doing to a degree? So I think that's still something we have to solve for. Today, it's too hard and it's too random, I would say.
Yeah, no, I completely agree. I think to your point, so it's a great way to close this out as we're at the top of the hour. The collaborations here as a part of this challenge, we're hoping, right, to be the force that can start to shape what that might look like and remove those barriers and encourage collaboration and partnership in a much more tangible and easy way. And so we're so excited to be working with you and the St. Luke's team, Reed. So thank you so much for sharing your insights. I'm sure it was tremendously helpful for folks as they complete their applications. And just a quick reference there before we close out, I'm going to throw in the chat here the link to the landing page for the Scale Health and Chime Workforce Challenge. If you have not yet signed up, you can do so there. You can also log into your account to complete your assessments there as well. And the deadline for submissions is the 13th of October. So you have just under a month to get all of your details and information added there. And as I mentioned, if through the process you have any questions, comments, please feel free to let us know. We're very easy to reach on the Scale Health team. We're all just first name @scalehealth.com. So you can email me directly, India @scalehealth.com. health. Would love to kind of be supportive of this process and make sure you guys have opportunities to work with fantastic people like Reed and John Mark and the team that's working with us on this challenge. So thank you all for spending an hour here with us, and we'll see you at the next webinar. We'll share details over email. So please